Hi guys, welcome to my channel. My name is Priscilla Kumah. I'm a registered nurse based in the United States. I am in New York State. I come from Ghana and I was a nurse in Ghana and I'm a nurse now here. My channel is about nursing, lifestyle, travel, and anything else you can see. I do some cooking and a lot of hot seats and interview people. So today I have someone on the hot seat and it looks like I'm now in Europe, even though I'm still in America. I've had guests that came all the way from UK onto the show via Zoom. That is, before I forget, I'm padding the picture quality and the sound quality and padding my voice. I'm not feeling my best today, but we're going to get this done and the information you need will be here. Are you a mental health nurse in Ghana, Nigeria, Kenya, Tanzania, any part of Africa or Asia, and you want to work in Europe, you want to work specifically in UK? Okay, I have a mental health nurse here on this channel today. She's going to tell us the journey, what you need to be able to practice as a mental health nurse in UK, even though you didn't school in UK. Hi, Joycelyn, welcome to my channel and introduce yourself.
Hi, Priscilla. So my name is Joycelyn Boateng. I'm from Ghana. I'm currently living in the UK and working as a nurse, a mental health nurse precisely.
You're already living in England and you're trying to see where do I start from? You have the right information. So we're going to take it up a notch. We're going to do it for somebody who is living in Ghana as a mental health nurse and wants to practice in England. Where should that person start from? Would the person look for an agency? Would the person start writing CBT on their own? What should someone in Ghana who wants to travel and work in England do?
Okay, so I'll tell you something before I proceed to that. Me living in England, initially I thought, oh, because I lived in England, I don't have to go through the process. I mean, there's something else for me to do, because you speak to somebody and the person says, oh, just ring up the NMC. They can be of help. But you go to the NMC platform or the website, and then they're like, once you're an international nurse, you have to do this and that and that and that. So I went through the process just like somebody living in Ghana. No difference at all. It's unfortunate that people living in Ghana want to do the OET, which is Occupational English Test. But then it hasn't begun there, I heard. It's only a computer-based something, and people are not very comfortable to do the computer-based exams because somebody that reached out to me said to me, I don't know how to type fast. So I said to them, me too. So you start with the English test, which is the OET or the IELTS. That's what most of my colleagues do. They do the IELTS. They can't travel to Nigeria. They can't travel to South Africa to do the OET. So they do their IELTS. And then you do your CBT. And then you come to England and do your OSCE. As simple as that.
Okay. So do they need to find a hospital before they start the process, or find an agency before they start the process?
I personally think that you can find an agency at any time, because loads of agencies looking to employ nurses, be it mental nurse, general nurse, midwife, whatever. There are loads of agencies looking for you to employ you. But if you get the agency first, there's this lady I speak to. She's passed the CBT, but then hasn't passed the IELTS. And she has an agency that has promised her, not promised, but she has agencies, not just an agency. She has agencies that have said to her, listen, just pass your IELTS and then come to England. I think it puts so much pressure on you when you have to find agencies or employers or whatever, when you haven't passed your IELTS. So I think it's fine, it's okay if you pass your IELTS, then you know you're on your way. But for you to just do your CBT and then say, oh, I'm traveling to England, it puts so much pressure on yourself. Oh, I've got an employer. My employer is waiting for me to pass my IELTS, to get my COS, blah, blah, blah. What if you pass your IELTS? There are lots of employers waiting to employ you. So just try and do your IELTS. Just try and pass your IELTS. Then you know you're on your way to England.
So do they necessarily come in any order? Do I have to take the IELTS first or before OSCE, or is there any order it has to follow?
Yeah, so you have to do your IELTS, your English test precisely. You have to do your IELTS or your OET, and then your CBT, and then you can come to England and do your OSCE. the OSCE is like a practice thing, which I mean needs to be done here only. So just do your IELTS, your CBT, and then you can come to England and do your OSCE.
You've all heard it from a person who is a living evidence of mental health nursing practicing in England, and people keep asking me, is there a way for us to do I have to be a diploma nurse, or do they need a degree before I can apply? What is the answer to that?
So you don't need to be a degree nurse to be able to get onto the NMC register. I'm a diploma nurse. I'm just in the process of doing my degree. I don't have a degree yet, but I'm on the NMC register. So you don't have to have a degree to be on their register. I was reading on their website and then I realized the nursing associates, I don't know if they are the healthcare assistants in Ghana, the community, I don't know too much. The nursing associates are on their register as well. So you don't need to have a degree to be able to get on there. Diploma nurses are all on their register.
That's a relief for people, because I know this video would be a lot of people good. So after you passed everything, you started working. Did you struggle finding a hospital? Did an agency place you in a hospital?
Not at all. I mean, England is always on the move session for nurses. So no, not at all. I didn't struggle at all. I mean, there are lots of agencies, employers looking to employ people, even the care homes, the hospitals. So no, it's not difficult at all to find an employer. No, it's not.
Where can a mental health nurse work? I'm sure the same applies for maybe for somebody with a specialty. Do you have to work with NHS? Do you have to work private care home, or you are free to work anywhere you want?
It all depends on you.
Oh.
You can work with the NHS, you can work with the private hospitals, you can work for the care homes. It all depends on you and what you are looking for and what you want to do. It all depends on you.
So where did you start from? Did you start with where are you?
Previously I used to work in the care home and I've just moved to the NHS. But I'm looking forward to, move back to the care home or join the private hospital again. So I think it all depends on the individual and what you're looking for and what you really want to do. Yeah. If you're looking for money, sorry, the NHS is not a good place for you. I can't hear you.
Yeah, I keep hearing that. Is there a reason people say NHS doesn't pay well? So is there a reason? They give you other benefits to subside, to cover up for that, to complement that, right?
So yes, the good thing with the NHS is that when you're ill, you get paid. But when you work for the private hospitals or the care homes, you don't get paid when you call off sick. That's just a difference. But the privates and the care homes are paying some good money, very good money. Yeah.
So I guess if you want the money now, it's better to get a care home. But if you want to save it up and get the maternity and the pension and retirement, then you have to go to the NHS. Okay.
Yes.
Okay, Joyce. So thank you very much for gracing the show once again. Let's zoom into your work life. How has it been working in England as a mental health nurse compared to working in Ghana mental health setting? Is there a difference? Did you struggle a little bit to pick up a lot of things? Did you have to study and catch up real quick? What kind of floor did you start with? What kind of unit or ward did you start with? Acute, chronic, anything you want to let us know?
It's not easy working in England. Not easy at all, especially when you practiced and worked in Ghana and you know how working in Ghana is like. You know, in Ghana, sorry, but things doesn't really work like it works in England. I don't know what to say. But yeah, I currently work in an older adult unit, and I can say it's lovely there. My patients are nice. I mean, they're able to communicate with you, even though there are some challenges at times. It's not easy working in England. Not easy. You go to work, and I mean, after all the struggles, the stress and stuff that you go through, you get to the house and you are all like, did I do this? Did I not do this? You know, it's like an unending thing. You get home and then you want to know what's happening at work. Not in a positive way. What are they going to say? Did I miss out on something? Did I do this? Did I not do this? I mean, I'm always on my phone, just waiting to log on to my work email to see if I've been sent an email. You just come out from the building and you're happy to get home. Unlike in Ghana, you can work for 6, 7 days and you can't be bothered, but not in England. You're always all stressed, all thinking about something. It's not easy. Not easy.
You said you started out in the care home before you came to NHS.
Yeah.
The care home, what kind of patients were you seeing? Like, what are the basic diagnoses that present over there? Is it bipolar, mania, schizo, drug abuse, or eating disorder? What kind of conditions did you see in the past, and where you are right now?
Okay, so in the care homes, most of the residents had dementia, and it was more or less like a nursing home. Okay. Yeah, and then there was a part that was also for patients with learning disabilities. So I did more or less like patients with residents with learning disabilities, and then older adults with dementia. That wasn't too much of a struggle because you do what you have to do for them, and you just finish it, or you just do what you have to do. Yeah.
Okay, guys, this is the part 2 of the show. If you're already following, if you haven't watched, I'm going to link up the first part of the video up here. Just make sure you click on the link and watch the part 1 out. These are also some of the recaps from the part 1. We have on the hot seat today is Joycelyn, who is a mental health nurse who originally schooled in Ghana and working in England. And she's telling us all the process, what you need to know. And now we're talking about work life, how it is working in England. So she has all the information. Make sure you watch this video to the end, share with other people. Don't sit on this information. So, Joycelyn, do you want to tell me about how the floor is? What is the workflow? Are you get assigned patients, like one nurse take care of 5 patients in conjunction with a nursing assistant, and what is the bed capacity over there? And the patients, are they chronic? Are they acute? Are they able to take care of themselves, feed, bathe, walk around?
Yeah, so it's a 14-bed capacity. There are times that it gets as low as 13, sorry. But then most of the time you get to the ward, you should be expecting 14 patients really. And we literally do stuff for our patients. You feed them, you give them medications, you assist them with personal care. Yeah, some of them are able to do things for themselves, like washing themselves, bathing themselves, but there are others that we pump them or we assist, we do it for them. Yeah, there are some that we do for them. And on duty is normally 2 nurses and then 3 healthcare assistants, or 2 nurses and then 2 healthcare assistants. But anything can happen. So you get to the ward and then you're the only nurse on duty. You have to be able to work. You should expect anything really. So that's just it.
So how many hours are you required to work in a week?
Okay, so it's a 37.5 hours. Yeah, but I do a 12-hour shift anytime I'm on duty. I start work at 7 and I finish work at 7:30. So I work like 3 days a week. And there are other people that want to do 9 to 5. Others also do 7 to 3 o'clock. And then others do 2 to Is it 2 to 10?
So, as a mental health nurse, what band do you start with? Band 4, band 5, band 6? Because you're a specialty area, I believe.
Okay, so I started on a band 5, but mostly with my colleagues that come from Ghana, they do start on band 4, just because they are not on the register yet. They kind of employ them as healthcare assistants first. Yeah, and then after your OSCE, you get to become a band 5. So yeah, that's what it is. But I started on a band 5 because I was able to do everything before joining the NHS, not because I'm special, no.
Okay.
Yeah, so you get to start on band 5.
And before you go to band 6, is it like you have to write an article, you have to do some paper or do an interview, or do you earn it?
You don't earn it, you have to do interviews. And normally where I work with my trust, we have an intranet that they let you know what they are looking for. So if you go on there and then there's a band 6 role, you could apply for it. And then obviously, if you qualify, you just get it. So it's not difficult at all.
So with your job, are you paid hourly or are you salaried? Are you paid at the end of the month?
Okay, so with the NHS, I get paid at the end of the month, but I've got agencies I work with that pay me weekly. Yeah.
So do you want to just mention some agencies for mental health nurses specifically? You know, any of these agencies they can go and look out for. And if you do, I would look them up. By the time you guys are watching this video, the links will be in the comments, in the description box. I'm sorry. How to get the link? Because people keep asking me, where do I find it? Just click on the topic of this video. It says show more. Click on show more and you find the links attached. Click on them, go to their website, do your research and go with the one that best suits you. Do not take this as a whole information. Do your research and choose the one that works for you. I'm sorry, please go ahead. The agencies, if you know a few.
Okay, so you can join the NHS. I mean, that's if you want to. You could get it via track jobs. And if you want to join the private hospitals, there's Elysium Healthcare, the Cigna Healthcare, and then there's one Priory Healthcare. Yeah, or better still, you can join the care homes. There are about 17,500 care homes in England. So you can join the care homes if you want to. So it all depends on like what you're looking for. If you're looking for money, if you're looking to join the NHS, care homes, yeah, it's entirely up to you.
So how many years have you been practicing now, and any challenges?
Oh, in the NHS, with the NHS.
How many years have you been a mental nurse? Your first job as a mental nurse in England, coming from?
Oh, I've been practicing for nearly 2 years now. Yeah.
With the NHS, how long have you been with the NHS?
With the NHS, I've been with them for close to 10 months now.
So is it flexible? Is it easy for somebody to move across? Today I'm at NHS, I'm at care home. Can you go? Are you bonded? Are you attached? Do you have some years you have to serve before you leave?
It depends on how you came into the country. If you have a contract with them, like if they are the ones that brought you from Africa, then yes, of course, you're bonded to them. And most of the time, their contract is about 2.5 years or 2 years or something. If you don't want to finish your 2 years or 2.5, whatever service with them, you could find a new employer. These private employers are willing to help you bail you out. Then some of the care homes are willing to pay your previous employers off and then take you to work for them.
Wow.
So like I said, it all depends on what you want to do. If you feel you're not happy, there are thousands of jobs in England. You could switch at any time. Anytime. You don't have to stay because you feel, oh, I have to pay back. No, you don't have to pay back. Just get an employer and the employer will sort your previous employer out. Then you are gone. Yeah.
So this information is authentic because Jocelyn has been living in England past 2 years, more than 2 years. So she has been on the grounds and has a lot of information for you. So go online, do your own research and find out anything you need. If you have any questions, you can always reach out to me. My inbox is open. You can find me on Facebook as Priscilla Lexi Kumah. You can find me on Instagram as Priscilla Kumah, on TikTok as Priscilla Kumah, on Twitter as Priscilla Kumah, on Instagram as Priscilla Kumah. I'm everywhere. And I have my email attached to the description box. So you can email me at priscillakuma@gmail.com. This has been very educative. I'm so grateful for your time. And that reminds me, I have a video coming up soon. I did interview a mental health nurse who lives in Ghana and works in Ghana. So I'm going to put that video out and you can see the challenges that Joycelyn mentioned. It's very different working in Ghana and very different working out in a Western world that is fast-paced. So I'm very proud of your journey. You must be pretty smart to be able to catch up very quick. We have to survive because we have to survive. And this is how we are made. This is where this is where we come from. We are strong Black African women and we are trying to make our country proud. And thank you, Joycelyn. Any last words, anything at all you want to say? Which area, maybe, if they come in, where should they try and focus and cut costs, in the city or the suburbs, the rural area, any place that is friendly to the Black community? Like I mentioned, some maybe 5 cities.
Okay, I used to live in London, before moving to where I live now. Okay. And I regret moving down here. I don't want to mention where I live now, but I regret moving down here. So yeah, where you live is also very important. If you're a nurse relocating to England, you should look at places like Nottingham, Manchester, Birmingham. These places are friendly places where things are cheap and that you get to get your African stuff to buy. Not like where I live, you have to travel like 5 miles before you get stuff for yourself. African stuff precisely for yourself. So yeah, Google is our friend. Just Google, get more information on. I've got people that tell me that, oh, Joycelyn, I like places like where you live because I want to bring up my children in a certain way, blah, blah, blah. So yeah, Google is our friend. Just Google, read, go through it. You'll be able to find more stuff on Google better than what people tell you. Just try hard. Life is not easy. People don't tell you what they go through in England. People regret coming to England. I know people that have gone back. I know people that, yes, they were brought into the country. They've got contracts with whatever trust, whatever hospitals, agencies, whatever, but then they have to go back because they can't. You go to work and it's like there's always something happening. Something has always happened. This is the side that people don't talk about. It is not easy. Not to scare or deter anybody from coming to England. England can be really nice. Really nice. Just try hard. Pass your exam. It's not easy to pass that exam, I know. Nobody passes that exam once. Well, I know a few people that have said, I passed the once. But if you don't pass on your first attempts, don't give up. You will get it one day. Just look at the positive side of it. You want to change your life. You want to have a good life. You want to have a better future and stuff like that. So just try, keep trying, and one day you will get it. And then come and live the life you want to live.
Okay. So you had the last words from Joyce. We can keep doing this, keep going. We will never finish because there's always something to touch on. But I'm very glad you gave me your time and grace the show, and I promise we would have to bring you back on this show. We'll find another day, a good time, a good topic, and have you back again. It's been lovely chatting with you. I'm not in my best mode today. Let me just apologize. I'm a little bit down, but I hope the message is clear and I hope this is informative. My name is Priscilla Kumah, registered nurse in New York, USA, and this is Joycelyn Boateng. She's also a registered mental health in UK. We all came from Ghana together to live in our various countries. Thanks for tuning in, and I'll see you in my next video. Remember to share. Remember to subscribe. Bye-bye.
Bye.